Hello, I'm Louisa Rose and I'm the Finance and Operations Director at HighEdge Consulting and one of the co-owners of the business.
Hi, I'm Peter Rose, Managing Director of HighEdge Consulting. And I love it. I am the glorious leader of HighEdge. I steer the ship through stormy waters. You'd be completely lost without me.
It was really Pete's decision. For many years he worked in different businesses. One time he always talked about becoming a consultant and setting up his own business and doing his own thing, being his own boss, like lots of people do think of. I just said, go on then, go and do it. Why not? Go be your own boss. You don't seem to like any of your other bosses. See if you like yourself as a boss. So we did.
I got made redundant. I'd long been thinking about setting up a consultancy because I'd had consultants, I'd used consultants, a lot of them were lackluster, told me what I already knew, all the bad stuff you hear about consultants, but wasn't quite brave enough to do it. But when you got made redundant, you're not giving up the healthcare, you're not giving up the company car, you're not giving up your salary, so we did it. So I also said to Louisa that every boss I had apart from one was an idiot, so she said, well, why don't you work for yourself and see if it's still true.
My background's actually in housing, which is probably far removed from medical devices it possibly could be. I didn't really have any particular interest in medical devices, but Peter did. And so I got involved on the financial side when he needed some help with the finances because he was getting busier and he wasn't very good at admin and raising invoices, so I took that over. And over a period of time I've learned a lot about medical devices myself just through working in the business.
We spent days, I drove all my friends bananas trying to come up with a name. Cut a long story short, getting really fed up. We lived just off a road called the A610. So I said to Louisa, why don't we just call it A610 Consulting and have done? We lived in a village called Heege, which was a corruption of High Edge from Old English. And Louisa said, well, why don't we just call it High Edge? And I said, that's it, you've got it. The level of regulation, even though the regulations haven't changed a huge amount, seems to be more intense. The implementation of the regulations is more intense. And notified bodies are far more interested in levels of detail that they weren't 10 years ago. So manufacturers, they have a hard time. They have to really try hard now, working at things like clinical evaluations, risk management, all the aspects of technical files and CE marking has just become more intense and more involved.
I would say in the last 10 years I've certainly seen the medical device industry become more innovative, and medical devices that are newly created have been coming to the market a lot quicker than what they used to. Whether that's because there's more investment in the medical device industry that allows that to happen, or whether there's more support, I don't know the answer to that, but certainly from my perspective I see a lot more medical devices coming to market.
In the next 10 years, I think it's going to change radically. The Medical Device Directive is already going through a recast. It was already started the recast procedure even before 2007-47 had been implemented. The PIP breast implant scandal has radically changed the way that people feel about medical device regulation. And certainly there's a feeling in the press at large that medical devices aren't well regulated. I disagree with that fundamentally, and I think regulation works. I think it works really well. I think that the Medical Device Directive as it stands now, which has been copied by so many other countries across the world outside of Europe, is a brilliant method of regulation. PIP breast implant, if I want to talk about that very briefly, was illegal activity. There were lies told and it was criminal. So that doesn't make the system of regulation flawed. But nevertheless, I think there will be more regulations involved, more red tape, and it will be more and more difficult for manufacturers.
The medical device industry, I think, is going to grow and continue to grow for the next 10 years. Yes, we have seen some retraction because of the recession within the EU and within the whole of the world, but To a certain extent, medical devices is recession proof, and because of that I think we're going to see a lot more investment into the industry, whether it be from business angels, private investors and funding through government as well. As far as what medical devices are likely to come through, I think we're going to see a lot more apps. Apps are becoming more popular, people are growing up with apps and it's becoming what's expected. Is there an app for that? We all say it, we all have, or most of us have iPhones, and we're used to looking for an app that will help us with a certain thing, and I think that's going to continue within the medical device industry, as well as the existing nanotechnology is also going to come more into medical devices as well.
It can be intense, but it's not as intense as you might think, because bizarrely we don't tend to work together that much. We've got different offices, so I sit in a separate office to Louisa, and we try very hard not to discuss work at home. So it's great, it's intense, it works really, really well. We both think pretty much the same things. We do have our heated discussions from time to time, but it works really well.
It can be hard work, and it can also be an awful lot of fun. There are times when you think we talk about business 24/7. You could be laying a night in bed and suddenly, oh, I just need to tell you about this, I just need to tell you about that, I forgot to tell you. We try not to take work home. Inevitably, it does sometimes come home. Working together, it's a lot of fun. Yes, we spend a lot of time together. Well, nothing actually really attracted me to it. It's through a process of need. I was needed to work in the business with Pete, using and utilising the skills that I had already established in previous employment. So it can be a very dry subject, and hopefully HighEdge and HighEdge staff will actually bring it to a bit of fun as well, and that's just the personalities of everyone involved in the business. So yes, it can be a very dry and unsexy topic, but hopefully we bring it to life.
Many people say regulations are boring and unsexy. Regulations are boring and unsexy, like me. However, as a certain type of person, regulatory people are a type of person, and they kind of like the rules and regulations. They're highly compliant.
From a client perspective, you get an awful lot of commitment from HighEdge Consulting. We are very knowledgeable, extremely knowledgeable in everything about medical devices and the industry. We work very hard in order to achieve what your objectives are. We can be hands-on, or we can act in a consultancy role. From an employee perspective, we're a lot of fun to work with. We are and act like a family organisation. People who come and work for us really do enjoy us. We have quite a good time in the office. It's quite funny a lot of times, especially with Pete around. He's like the comedian of the business. And it's just, sometimes can be hard work, but most of the time it's just jolly good fun. I hope that HighEdge will become even more successful than what it is. We would like to see the growth that we've seen over the last few years continue, so we become a very well-known consultancy business and the first choice for companies who are looking for consultants. Dreams? I don't think either myself or Pete want it to become such a huge company that we're not in control of it. We like to be in control of it, but at the same time we also realise and recognise that we have to give bits up in order for it to grow.
I hope that HighEdge continues to grow. I hope that we end up being one of those companies that everybody knows just by name, by reputation, that breaks the moulds of consultants. The sort of company where a consultant really gets in there and helps you and doesn't do what I had done to me when I was in hiring consultants, which is someone tell you what you already know and just tell you what to do and not do it. We want to be able to be hands-on, practical and genuinely helpful.